Top 10 Home Remedies to Get Rid of Hemorrhoids. Hemorrhoids, also known as piles, can be a source of discomfort and pain for many individuals. These swollen blood vessels in the rectal area can cause itching, pain, and bleeding during bowel movements. While severe cases may require medical intervention, there are several home remedies and lifestyle changes that can help alleviate symptoms and promote healing. In this video, we will explore 10 effective ways to get rid of hemorrhoids, ranging from dietary adjustments and topical treatments to self-care practices and medical advice. By incorporating these strategies into your routine, you can find relief and improve your overall well-being. However, it is always recommended to consult a healthcare professional for a proper diagnosis and personalized treatment plan. Number 1. Increase fiber intake. A high-fiber diet is one of the key ways to manage and prevent hemorrhoids. Fiber adds bulk to your stools, making them softer and easier to pass, thus reducing the strain on your rectal area. Including a variety of fiber-rich foods in your diet can help regulate bowel movements and promote overall digestive health. Here are some tips to increase your fiber intake. Incorporate fruits and vegetables. Opt for fruits like apples, berries, oranges, and vegetables such as broccoli, carrots, and spinach. These are excellent sources of fiber. Choose whole grains. Replace refined grains with whole grains like whole wheat bread, brown rice, and oatmeal. These contain more fiber and provide better nutritional value. Include legumes. Beans, lentils, chickpeas, and other legumes are packed with fiber. Incorporate them into soups, salads, or side dishes. Snack on nuts and seeds. Almonds, chia seeds, flax seeds, and sunflower seeds are high in fiber and make for nutritious snacks. Consider fiber supplements. If it's challenging to meet your daily fiber requirements through diet alone, you can consult your doctor about fiber supplements like psyllium husk. Remember to increase your fiber intake gradually and drink plenty of water throughout the day. Adequate hydration is essential for the fiber to work effectively and prevent constipation. By including more fiber-rich foods in your diet, you can promote regular bowel movements and reduce the risk of hemorrhoid flare-ups. Number 2. Stay hydrated. Staying hydrated is crucial for maintaining proper digestive health and preventing constipation, which can exacerbate hemorrhoid symptoms. When you don't drink enough water, your stools can become hard and difficult to pass, leading to straining during bowel movements and increased pressure on the rectal area. Here's how you can ensure adequate hydration. Drink water regularly. Aim to drink at least 8 glasses of water per day, or more if you engage in physical activity or are in a hot climate. Avoid excessive caffeine and alcohol. Beverages like coffee and alcohol can have a dehydrating effect, so it's important to moderate your consumption. If you do consume them, drink extra water to compensate. Eat hydrating foods. Include water-rich foods in your diet, such as watermelon, cucumbers, oranges, and soups. These foods contribute to your overall hydration. Carry a water bottle. Keep a water bottle with you throughout the day as a reminder to drink water regularly. Listen to your body. Pay attention to your body's thirst signals and drink water whenever you feel thirsty. By maintaining proper hydration, you can soften your stools, promote regular bowel movements, and reduce the discomfort associated with hemorrhoids. Remember, water is the best choice for staying hydrated. While other beverages can contribute to your overall fluid intake, it's best to rely on water as your primary source of hydration. Number 3. Use topical treatments. Topical treatments can provide temporary relief from the symptoms of hemorrhoids, including itching, pain, and inflammation. Here are 2 commonly used topical treatments. 1. Hydrocortisone creams or ointments. These over-the-counter products contain a low-dose corticosteroid called hydrocortisone, which helps reduce itching and inflammation. Follow the instructions on the packaging and apply a thin layer of the cream or ointment to the affected area a few times a day. 2. Witch hazel. Witch hazel is a natural astringent that can help soothe and reduce swelling. Look for over-the-counter products like medicated pads or wipes that contain witch hazel and use them as directed. Alternatively, you can soak a cotton ball or pad with witch hazel and apply it directly to the hemorrhoid for relief. When using any topical treatment, it's important to follow the instructions provided and avoid excessive or prolonged use. If your symptoms persist or worsen after using over-the-counter topical treatments, it's advisable to consult a healthcare professional for further evaluation and guidance. It's worth noting that while topical treatments can provide temporary relief, they do not treat the underlying cause of hemorrhoids. It's important to incorporate other lifestyle changes and remedies to manage hemorrhoids effectively. Number 4. Practice good hygiene. Practicing good hygiene is essential for managing hemorrhoids and preventing further irritation or infection. Here are some tips for maintaining proper anal area hygiene. 1. Use warm water. After each bowel movement, gently clean the anal area with warm water. You can use a sitz bath, a basin filled with warm water that you can sit in, or you can use a handheld bidet or a clean, soft cloth soaked in warm water. Avoid using hot water, as it can cause further irritation. 2. Pat dry. After cleansing, gently pat the anal area dry with a soft towel or use a hairdryer set on a cool setting. Avoid rubbing, as it can cause irritation. 3. Avoid harsh soaps. Use mild, unscented, or fragrance-free soaps when cleansing the anal area. Harsh soaps, perfumes, or dyes can irritate the sensitive skin and worsen hemorrhoid symptoms. Opt for gentle, hypoallergenic cleansers if necessary. 4. Avoid using dry toilet paper. Dry toilet paper can be abrasive and further irritate the hemorrhoids. Instead, opt for moistened, unscented wipes or consider using a bidet for a more thorough and gentle cleaning. 5. Wear loose-fitting, breathable underwear. Choose cotton underwear that allows for proper airflow and reduces moisture buildup in the anal area. Avoid tight-fitting clothing that can increase irritation and discomfort. By practicing good hygiene, you can keep the anal area clean and reduce the risk of further irritation or infection. Remember to be gentle when cleaning, and avoid any products that can cause additional irritation or discomfort. If you have any concerns or persistent symptoms, consult a healthcare professional for guidance. Number 5. Take warm baths. Taking warm baths, also known as sitz baths, can provide soothing relief for hemorrhoid symptoms. Here's how to take a warm bath to alleviate discomfort. 1. Fill the bathtub. Fill a bathtub with warm water. The water should be comfortably warm, but not hot. 2. Sit in the bath. Carefully lower yourself into the bathtub and sit in the warm water. Ensure that your anal area is fully submerged. 3. Soak for 15 to 20 minutes. Remain in the bath for 15 to 20 minutes, allowing the warm water to gently soothe the hemorrhoid area. 4. Gently pat dry. After the bath, gently pat the anal area dry with a soft towel. Avoid rubbing, as it can cause irritation. 5. Repeat as needed. You can take warm baths a few times a day, especially after bowel movements, to help reduce itching, pain, and swelling associated with hemorrhoids. Sitz baths can help alleviate discomfort by promoting blood flow, reducing inflammation, and providing a soothing effect. However, it's important to note that sitz baths provide temporary relief and do not treat the underlying cause of hemorrhoids. If your symptoms persist or worsen, it's advisable to consult a healthcare professional for further evaluation and guidance. Number 6. Apply cold compresses. Applying cold compresses to the affected area can help provide temporary relief from pain, itching, and swelling associated with hemorrhoids. Here's how to use cold compresses effectively. 1. Prepare a cold pack. Wrap a few ice cubes in a clean cloth or place them in a sealable plastic bag. Alternatively, you can use a commercially available cold pack. 2. Protect the skin. To prevent direct contact between the cold pack and your skin, wrap it in a thin cloth or towel. This will help avoid iceburn or frostbite. 3. Apply the cold compress. Gently apply the wrapped cold pack to the external hemorrhoid area for about 10 to 15 minutes. Avoid prolonged exposure to prevent skin damage. 4. Take breaks. If the cold becomes uncomfortable, take short breaks between applications. Allow your skin to warm up before reapplying the cold compress if desired. 5. Repeat as needed. Use the cold compress several times a day, especially when experiencing discomfort or swelling. However, avoid excessive use or prolonged exposure to cold, as it may cause tissue damage. Cold compresses can help numb the area, reduce inflammation, and provide temporary relief. However, it's important to note that cold compresses do not treat the underlying cause of hemorrhoids. If your symptoms persist or worsen, it's advisable to consult a healthcare professional for further evaluation and guidance. Number 7. Avoid straining. Avoiding straining during bowel movements is essential for managing hemorrhoids and preventing further irritation. Here are some tips to help you avoid straining. 1. Respond to the urge. When you feel the urge to have a bowel movement, respond promptly. Delaying bowel movements can cause stools to become harder and more difficult to pass, leading to straining. 2. Establish a regular bathroom routine. Try to establish a consistent schedule for bowel movements. This can help train your body to have regular, more predictable bowel movements. 3. Take your time. When you're on the toilet, take your time and allow yourself enough time to have a bowel movement without rushing. Rushing can lead to straining. 4. Don't strain. Avoid straining or pushing forcefully during bowel movements. Instead, relax and let the natural process take place. If you're having difficulty passing stools, it may be helpful to elevate your feet with a small stool or a footrest to achieve a more natural squatting position. 5. Avoid prolonged sitting. Sitting on the toilet for long periods can put unnecessary pressure on the rectal area. Try to limit your time on the toilet to avoid straining and prolonged pressure. By responding to the urge to have a bowel movement, taking your time, and avoiding straining, you can reduce the risk of exacerbating hemorrhoid symptoms. If you're experiencing chronic constipation or difficulty with bowel movements, it's advisable to consult a healthcare professional for further evaluation and guidance. They can help identify any underlying causes and recommend appropriate treatment options. Number 8. Exercise regularly. Yes, regular exercise is beneficial for promoting regular bowel movements and preventing constipation, which can contribute to hemorrhoid symptoms. Here's how exercise can help. 1. Stimulates bowel movements. Physical activity helps stimulate the muscles in your intestines, promoting regular bowel movements. When you engage in exercise, the rhythmic contractions of your abdominal muscles can help move stool through the digestive system more efficiently. 2. Prevents constipation. Regular exercise can help prevent constipation, which is a common cause of hemorrhoid flare-ups. By increasing your overall activity level, you can enhance the functioning of your digestive system and maintain regularity. 3. Promotes overall health. Exercise has numerous health benefits, including maintaining a healthy weight, improving circulation, and reducing the risk of various health conditions. By staying active, you support your overall well-being, including your digestive health. Low-impact exercises like walking, swimming, cycling, and yoga are particularly helpful for individuals with hemorrhoids, as they put less strain on the rectal area. However, any form of exercise that gets you moving and increases your heart rate can be beneficial. It's important to note that if you have severe hemorrhoid symptoms or other underlying health conditions, it's advisable to consult a healthcare professional before starting a new exercise routine. They can provide personalized recommendations based on your specific needs and medical history. Number 9. Use stool softeners. If you experience chronic constipation, your doctor may recommend the use of stool softeners to help make bowel movements easier. Stool softeners work by increasing the amount of water in the stool, making it softer and easier to pass. Here's what you should know about stool softeners. 1. Over-the-counter options. There are several over-the-counter stool softeners available, such as docusate sodium. These medications are generally safe for short-term use, but it's important to follow the instructions on the packaging and consult with a healthcare professional if you have any concerns or if your symptoms persist. 2. Prescription medications. In some cases, your doctor may prescribe stronger stool softeners or other medications to address chronic constipation and promote regular bowel movements. These medications may have specific instructions and potential side effects, so it's important to follow your healthcare professional's guidance. 3. Proper use and timing. Stool softeners are most effective when taken with a full glass of water and should be used according to the recommended dosage and schedule. It's important to note that stool softeners may take a few days to work, so it's essential to be patient and consistent with their use. 4. Consult with a healthcare professional. It's important to consult with a healthcare professional, such as your doctor or a pharmacist, before starting any new medication, including stool softeners. They can provide guidance on the appropriate type, dosage, and duration of use based on your specific condition and medical history. Remember that stool softeners are not intended for long-term use without medical supervision. It's important to address the underlying causes of chronic constipation and work with a healthcare professional to develop a comprehensive treatment plan. Number 10. Seek medical advice. If home remedies do not provide relief or if your hemorrhoids are severe, it is advisable to seek medical advice from a healthcare professional. They can assess your condition and provide appropriate treatment options. In some cases, the healthcare professional may recommend procedures such as 1. Rubber band ligation. This procedure involves placing a small rubber band around the base of the hemorrhoid to cut off its blood supply. The hemorrhoid then shrinks and falls off within a few days. Rubber band ligation is commonly used for internal hemorrhoids. 2. Sclerotherapy. Sclerotherapy involves injecting a chemical solution into the hemorrhoid, causing it to shrink and eventually disappear. It is typically used for smaller internal hemorrhoids. 3. Hemorrhoidectomy. In rare cases where other treatments have not been effective or for large, protruding hemorrhoids, surgical removal may be recommended. A hemorrhoidectomy is a surgical procedure to remove the hemorrhoids. These procedures are usually performed by gastroenterologists or colorectal surgeons. The choice of procedure depends on factors such as the severity and location of the hemorrhoids, as well as your overall health and individual circumstances. It's important to consult with a healthcare professional to receive a proper diagnosis and discuss treatment options. They can provide guidance tailored to your specific needs and help alleviate your hemorrhoid symptoms effectively. Thanks for watching. Don't forget to give it a thumbs up and subscribe to our channel for more informative content. Thanks for watching, and we'll see you in the next video.